Hashimoto thyroiditis is now considered a common autoimmune disease, affecting predominantly women. There are several forms of the disease, each with specific features, but all of them are characterized by the infiltration of white cells among the thyroid follicles. In simple terms, it's as if the thyroid cells are attacked by our immune system, and that's why this is considered an autoimmune disease. Most of Hashimoto's forms ultimately evolve into hypothyroidism, and so far conventional treatment remains symptomatic and based on the administration of synthetic thyroid hormones to compensate for hypothyroidism. The additional role of diet for the management of this disease is usually overlooked. However, there's a review article published in 2017 in a Greek journal of nuclear medicine that compiles the literature search regarding the importance and the influence of iodine, selenium, vitamin D, and gluten on Hashimoto's thyroiditis. For simplicity purposes, in this video, we'll focus on the role of selenium, but we encourage you to watch the videos on the role of the other factors. Selenium is an essential micronutrient with many effects ranging from antioxidant and anti-inflammatory to increasing active thyroid hormone production. In Hashimoto's patients, studies have shown different results regarding the efficacy of selenium supplementation. According to this review article, 3 meta-analyses have confirmed a suppressive effect of selenium supplementation on serum TPO and TG levels in Hashimoto's patients, which means a decrease in the antibodies attacking the thyroid. The study mentions a particular systematic review and meta-analysis published in 2016 that showed results were different according to the selenium chemical form used to supplement. Patient groups receiving 200 micrograms Selenomethionine experienced a significant decrease in antibodies, but those receiving 200 micrograms sodium selenite didn't. The difference might lie in the fact that the absorption of selenite is approximately 2/3 of the absorption of Selenomethionine. This might be the reason why another meta-analysis concluded that the evidence to support or refute the efficacy of selenium supplementation in patients with Hashimoto's thyroiditis is insufficient. Additionally, a phenomenon that has not been studied with sufficient experimental data is that selenium deficiency causes accelerated iodine depletion. This may be a protective adaptation against thyroid damage when selenium is deficient and iodine is adequate. Supplementing a Hashimoto's patient who is deficient in both elements with either selenium or iodine alone would be ineffective, and in certain cases, could cause complications. This explains the deterioration of thyroid function, which was observed after selenium administration to iodine-deficient people in another study. Before we conclude, please don't forget to subscribe to our channel if you're curious about science applied to health issues, and hit that bell icon so you receive the notifications every time we upload a new video. In summary, the study concludes that selenium supplementation in the form of Selenomethionine would be beneficial amongst Hashimoto's patients with selenium deficiency and adequate iodine intake.
Please note this video is our interpretation of scientific papers. It is merely informative and doesn't constitute any form of advice. If you have any health issues or concerns, please contact your physician or licensed health professional.